Joining us now is President and CEO of Public Health Institute of Metropolitan Chicago, Karen Reitan. Karen, welcome back to the show.
Hi.
Good
morning.
Good morning.
Karen.
Thank you so much for joining us today. And congratulations on over 30 years of doing the good work. Can you just take a brief moment to remind our listeners about the history and mission of Public Health Institute of Metropolitan Chicago?
Sure. So we were founded 31 years ago by the Chicago Department of Public Health. And the first chunk of our existence, we worked exclusively with them on program implementation. And now we do a broad range of public health and systems transformation work that's all focused on advancing health justice and strengthening public health through innovation and partnerships that align people, strategies, and resources.
So how about how
systems level work?
Yeah, a lot of systems level works and a lot of like you were saying, collaborations with different organizations. About how many different organizations do you think you all work with?
We collaborate with more than 100 organizations statewide. It's a really good group.
Yeah, that's amazing. And I know, like, with all of this work that you are doing, because I know part of the PHIMC, for some reason I always screw up that little alphabet salad right there.
It's a very long name.
It is a very long name.
Very wordy name.
But I know that, we've talked with folks because Illinois Safe Schools Alliance is now a part of PHIMC. What other LGBTQ initiatives do you help support?
Sure. So we have first I'm going to say that every public health initiative, no matter where it is, supports LGBTQ people because we are everywhere.
Thank y'all.
Yeah. So that said, we have some very specific initiatives targeted to LGBTQ folks. The Alliance is one of our favorites. They're all my favorites. I really shouldn't even say that.
Right.
We merged in 2019 with the Illinois Safe Schools Alliance, and they've rebranded as the Alliance, and they work specifically to support safety and healthy development for LGBTQ and questioning youth through advocacy and teacher training. We have a really great 5-day, 5-night sleepaway camp in the summer. We do youth organizing, professional development. So sort of really how do our communities and our schools affirm LGBTQ youth and keep them safe and keep them healthy and on the path to a great adulthood.
How do these youth... I'm sorry, finish your thought.
Go ahead. No, I was going to go on to my next program, but I'm happy to talk to you about the Alliance.
I was just wondering how you get to these kids to let them know you're there.
So we work a lot with the GSAs around the state. They used to be called the Gay Straight Student Alliances, and now I think that stands for Gender
Sexuality Alliance. Yeah. Mm-hmm.
Yeah. So they are in schools, public schools around the state, really creating spaces for LGBTQ youth and their straight allies to come together. So we do a lot of work with those folks. The Alliance has been around 20 years, and so we have a lot of connections with other agencies and with schools and school districts. So there's a lot of historical work that we draw on to reach out to adolescents. And, I got to say, I grew up without the internet, but today, people growing up with the internet, young people, they just find us.
Yeah, they do.
Good.
They do. Yeah. And that particular camp develops like the leaders of the future, which is just chef's kiss. So thank you for that.
Well, thank you.
What other organizations do you partner with?
Sure. We fund a number of organizations through something that is called the Transgender and Gender Diverse Wellness and Equity Program. We didn't name it, but we could have because we like a lot of words.
Right.
In our names at PHIMC. This is a really great, public health uses lots of words, always. This program, we just mostly call it TGD in-house. Mm-hmm. It's a really fantastic program funded by the State Department of Human Services, and it funds all across the state clinical settings, hospitals, social service agencies, etc., who want to increase and improve services for transgender folks and gender diverse folks. So there's a fair amount of patient navigation funded, so someone who helps LGBTQ folks navigate the healthcare system. It could be training. We're funding the Legal Council for Health Justice for a hotline that they are just launching. One site wanted to rebuild a website and create a community hub. So it's really a very diverse set of services, but really all of them focused at making sure that if LGBTQ folks come to a medical center or a service center, that they are welcomed and treated with all the respect and dignity that everyone else gets treated with, and that the providers know what the unique medical or psychosocial services they might need.
That's amazing. That I mean,
is.
it's incredible work. Now, because this is like public health, y'all have to have been affected by federal cuts, thanks to you
Yes,
know.
we were.
Yeah. How are you?
Yeah,
how?
we had a big. Go ahead.
No, it's just like how's that? How are you
How you
holding up?
overcoming
Like,
it? Yeah.
You know, it's a really tough time to work in public health. I cannot lie. We did have a big cut in April when DOGE was clawing back contracts, close to $1 million, and we were very lucky that the state of Illinois restored some portion of it. But it was very chaotic. I think this has played out at a lot of agencies. You get an email from your funder, and they say your program's done today.
yeah.
You can't bill anymore.
Horrible.
Don't do any more work. So we laid off a bunch of people, and then there's a court case and an injunction and lots of confusion. And a couple weeks later, we get an email saying there's an injunction. We're pulling down as much federal money as we can. Start work again. So it's just very, it's a little crazy making, and it's really hard on our staff and partners, and most importantly, the people that we serve.
Right.
Yeah. It's a roller coaster.
Yeah.
It's horrible. But you're hanging in there, it sounds like. So good.
Yeah, we are trying, and we have a nice mix of programs. So when one is a little less funded, one is maybe a little more funded, but it'll be interesting to see. Public health has long been a public-private partnership between government and foundation, donors, and community-based organizations. And when the government piece at the federal level disappears, it creates a huge void. And there is not enough money at foundations or with any donors or that we could raise in any way to make up for what the billions that the government puts into public health.
All right. Well,
And so it's an interesting and really scary time for the field.
yeah, and it sounds like it is the perfect time to gather together to celebrate and to rally support for public health. So what is in store for the fall reception, All In for Public Health at the American Writers Museum on November 18th?
Yeah, thank you for asking. Last year, PHIMC celebrated its 30th anniversary, and we had a reception. And it was so much fun, we decided we were going to have another one, and so it might become a regular thing, but it's a fundraising reception at the American Writers Museum. They're so gracious. That space is beautiful. If you've never been there, you should definitely go. And it's just a couple hours. We're going to have some a spoken word artist talk about his experiences. We're doing a paddle raid, except we have these really great Pride fans, so you can flick your fan when it's time to donate.
Love it.
Oddly enough, people love public health trivia. I think they love trivia in general, so we have great trivia game, and we'll give out prizes. And then there's food and drinks, and we have an amazing raffle with some very cool stuff in it. And so it's really just a couple hours in the evening to gather and enjoy a beautiful space and maybe give a little money to help PHIMC. And it's a lot of public health folks that come, too, so it's a great sort of networking and collaboration building moment.
Well, if folks aren't able,
Mostly, it's just a good party.
yeah,
Sounds
well, if
fantastic.
folks aren't able to make it to the big party, how can they still support your work?
So if you can't, anyone can donate to support our work at any time at phimc.org. That is our website. You can donate. You can also learn more about what we do. You can also look. We have all of our partners on our website, and supporting them is supporting us. Like, we're a community of partners. And so if systems transformation and public health sort of infrastructure, what we do is not really your jam, there's lots of other places out there that do great work.
Yeah, you
But
know,
we
throughout
think
this
ours is pretty good.
entire nightmare of this administration, I've always said when things are getting too big and you're too overwhelmed, stop. Shrink your focus, look local, look towards your community. And right now with PHIMC, you've got a network of communities right here. And if you are looking for something that will make you feel good to help you support, go and help support either PHIMC or any of these organizations. And if you really feel like, if you're happen to be downtown right on Michigan Avenue, make sure you stop by the Public Health Institute of Metropolitan Chicago's fall reception, all in for public health. It's at on November 18th at the American Writers Museum. And for tickets, and again, for more information about the organization and partnering organizations, go to phimc.org. Karen Reitan, thank you so much for joining us today. And thank you for all of the work that you are doing during these really kooky pants times.
Yes, indeed. Thank you, Karen.
Thank you so much. We really appreciate being highlighted on your show. It's so generous.
It's our
We're so
pleasure.
grateful.
Anytime, please. The door is always open for you.